the effect of fluoride toothpaste on dental cavities, the best study design is a prospective cohort study. So this is hypothesis or research question really is essential in deciding what study design to select. Minimize the best study design, as we said, it minimizes biases and confounding, and then leverage it will help to leverage the level of evidence. The study design should always be ethical and feasible. This is very interesting. Ethical and feasible are basic that we cannot omit or ignore. So type of question and suggested study design for therapy is randomized clinical trial. For etiology is randomized clinical trial, then followed by cohort, case control, or case series. For prognosis, its cohort study is the best study design, followed by case control or case series. Prevention, also for prevention, is the same as therapy, and etiology, it should be randomized clinical trial. For diagnosis, it will be prospective and blind comparison, it will be the gold standard. As you see in this pyramid, evidence of pyramid, the best is really randomized clinical trial. On the top is systematic review on meta-analysis, followed by randomized controlled clinical trial, cohort studies, case control studies, case series, case report, and so on. So as you see, descriptive studies are at the bottom, then cohort, then analytical studies, then we come to the interventional experimental studies, and on the top notch is the systematic review and meta-analysis. In summary, case series is a coherent set of cases of a disease. That's it. In a population studied at a specific time and place, we call it cross-sectional. Always the primary output is prevalence data. Though association between risk factors and disease can be generated, because we are looking for both exposure or outcome. So we can talk in cross-sectional study about association between exposure and disease, but not causation, not at all. Do not use the word cause in once you are discussing the results of your cross-section. Case control studies, we know the outcome, we look for the exposure. We select based on the disease, we want to know what are the risk factors. In cohort, we know the risk factor, but we want to follow up to look if they develop disease or not. In a population of study are divided in two groups. If the population of study is divided in two groups and the investigator impose a health intervention, the design is a trial. So in conclusion, it is the well-defined research question that dedicate the study design. Not that every study should be a randomized clinical trial because it's the gold standard. The proper use of evidence-based information is not the strict adherence to only randomized clinical trial, but more accurately, the informed and effective use of all types of evidence. Thank you so much, and I hope you really enjoyed this too much knowledge and information in this 1 hour presentation.
Thank you, Dr. Attanir. Thank you so much for your outstanding and informative lecture. Sorry, there is no time to direct questions of attendee to Q&A as we run out of time, and we have to move to the next session. But as I promised, we will reach you with the answer either through email or WhatsApp. Thank you again, Dr. Attanir.